So I'm gonna open up this committee meeting for 2/18/25. I'm gonna call it to order. I have BSS, please. Hi, Bob. How are you?
Good, how are you?
Good, thank you.
Afternoon. It's like everybody's left Bob's office and he's on his staff, right?
Yeah.
Well, yeah, so
Yeah.
we went to point one, and we talked about the appropriate dates for hire for each one of these.
Boy.
And then we went back, so we're ready. And I would just, I'll just go one by one. If there's any questions at all, I'm happy to answer them. The first one is the senior social welfare examiner. I'll move it.
Second.
All in favor?
Aye.
Opposed? Questions?
Are the dates
Carried.
of hire
Is
based
that
on
what it's supposed to do?
availability
Is
or
it have to
need
be?
or both?
A little mix of everything, yeah.
Okay.
Okay,
Yep, you're good.
the second one is caseworker assistant.
Second.
All in favor?
Aye.
So carried. Oh, questions? Okay.
Okay, the third is assistant social services attorney.
Move it.
Second.
Questions? All in favor?
Aye.
So carried. Thank you.
And, the fourth is director of child support.
Move it. Second.
Questions? All in favor?
Aye.
So carried.
And fifth is the bookkeeper. One bookkeeper.
Second.
Questions? All in favor?
Aye.
And so carried.
Okay, the next is one grant funded caseworker position.
Move it.
Second?
Second.
Questions? All in favor?
Aye.
So carried.
And, finally, a child support specialist.
Oh, I had another caseworker for you, Bob.
Oh, I'm sorry.
Yep.
I skipped right over that.
Okay, I just want to make sure.
I'm just keeping you on your toes.
Yeah,
We'll go
Yes,
back.
you're working, it's working.
I'll move the caseworker position.
Okay,
Second? All in favor?
Aye.
And so carried.
and then the child support specialist.
Move it.
Second.
All in favor?
Aye.
And so carried.
All right, the contract amendment has to do with the mission over at the church, which, given circumstances this winter was hard to even watch people walk out in the morning, given the weather. Talked with the state. We talked a couple of times and they said, we think you should open 24/7. It's okay that you do that. There'll be funding for you. So I needed a contract to do that.
Okay.
I'll move it.
Second.
All in favor? Any
Aye.
questions? And so carried.
Now, in terms of the contract, have they sent that down yet or?
I don't know. I think it's just circling now. It's made a part of this and it's got to be approved before anybody starts to sign it.
Okay.
And the contract will be for the balance of 2025 or,
Through the end of the cold blue season this year,
so that would be April.
30th,
Okay.
unless there's an extension. We'll watch the weather at that point. But very likely the new code blue contracts will be for 24 going forward. So we'll be putting that, our allocation with the state will go up accordingly.
Has this been the contract that's resulted in the reduction of numbers of homeless? Or,
Well, I mean, in as much as 20 folks have been staying there.
right,
But they would still be counted as homeless.
Yeah.
are they still counted?
Yeah.
Okay, that's what I was gonna ask you that when we got to the report.
So we have a place to put them.
A lot, I've been to the hospital, a lot of them are up in the hospital,
Well-
those little cubicles there, or they,
That's why we opened 24,
gotcha.
because that's a problem.
They wanted them out.
Yeah, and I understand. You know, they're trying to administer a hospital. They're just going wherever they can get
To get
warm,
warm, yeah.
right? They tried Stewart's, understandably, then in the hospital, sometimes they'll go over to HPD.
Mhm.
And that's kind of what I told the state. I mean, what would you do? You find this closest warm space that you could. And so they, you know, they really kind of came up with it. So I'm very pleased about that.
So do we count that in rooms after the homeless numbers? No, not, okay. So they're in the individual and family count, but they're not counted in rooms.
Yeah.
Okay.
Because, we wouldn't have that many rooms, quite frankly, if we were looking at
Thank you.
it. Yes. All right, well, thanks, folks.
Thank you.
Yeah, Bob.
Danny.
I just have those two resolutions there, and they're just what was left off, unfortunately, our last resolution from last month, but these have been programs that we funded. One is from the Youth Development Prevention Funding, and the other one is the Sports and Education Funding. So we fund through their programs out there.
Move both of them.
I'll second both of them. We
Questions?
vote on two at once?
Yeah. Any questions? I mean, you're right, all in favor?
Aye.
And so it goes, so it's carried.
So just the program updates, I had a couple of calls regarding the swings, and I know it's surprised them. So I called the Department of State today, I checked with Jim Bray. The contact person we had no longer is at that number. So I called Senator Hinchy's office and they're inquiring for us. So
Okay.
as soon as I hear anything, I'll get back to the six towns in the city of Hudson.
They did the press release.
Yeah.
The press, not for the individual towns, but for the funding allocation, saying that the money had been funded.
Perfect. So hopefully their office, they're usually pretty good about getting to me. And the other thing is, so we're moving forward with the May 21st Youth Leadership Banquet. So things are in play and we have the nomination forms ready to go out to all the, and I don't know if we said this group. So the committee wanted to expand the net of finding the lead, the kid that would be the most leadership recognizable. So we've included homeschooling, a star,
Mhm.
4-H, and I believe it was Boy Scout. So, and if there's any other entities that are out there that we can find or someone has, we'll include them into it. So I think the idea was to try to include more than just the public schools.
Yes, use anything that had to do
Yeah.
with youth
So-
leadership, yeah.
So that's
Nice.
what we're doing.
So would that include Hawthorne Valley or Darrow School or who else? Hawthorne Valley, Darrow.
So that's our hope. So what we need is, so what we wanted to try to do is not get so big that we just lost control of it. So we're going to try to do it incrementally
Mhm.
to make sure, because we don't want to get 4 new ones and lose 6 old ones. So we want to kind of keep something steady and stable, because it's really, this is only my second year doing it. So my hope is that the contacts we created last year are the same ones this year, and we can move. But we have now a committee of 6 of us that are actually functioning to put it on. So looking
You
forward
did
to
a
it.
great job, Bruce. Great
Yeah.
job.
Who was the one?
So again, May 21st, we'll have hopefully a board of supervisors table again. And you got to sit at the board of supervisors, so I don't forget your name.
Is it?
So that's it for us.
Are we, the summer, what were they, the grants for the circus that went around? Are they gonna happen again this year?
Yes, thanks to the commissioner back here.
Okay,
Yeah, probably we'll sit at the supervisor's table this year because it's the second year in and it wasn't as,
Mhm.
so, I mean, it's a big honor, yeah. So it's-
because we already have a date for our event, so
Okay,
that information is forthcoming.
do you want to get,
At a calendar, it's June 14th, but I can send you an email.
okay, that's great. And usually you'll have
October 29th.
I like this.
Remember all those days?
Yeah, right. You got them all there, right?
I'll know this is the tree that we.
Mine's easy.
I'll send you an email.
Okay. All right. Perfect. Thank you.
Thank you, Dan.
Okay, next, Joe Ambrose, please. Hi there.
Hello.
Hello.
Shooting for Dan's on vacation.
Lucky him.
No.
Yeah.
There you
Got a
go.
lot of people on vacation.
It's in the Carolinas. I don't know the weather's down.
Oh, they're
gonna
gonna
get
get snow.
They have snow tomorrow.
Not much better than here.
Okay, the first request is for to use federal salary share, up to $60,000 for a vehicle for the Columbia County Recovery Kitchen.
So happy to move this.
I'll second it.
They make 2,000 meals a week in our county.
And then we have advertisement up on the floor.
So happy.
Discussion.
Discussion?
Do we have a second?
Yeah,
Yes,
second,
Ron.
on second.
All right. I just wanted to say that at prior to last month's meeting, I had asked Dan to pull it because I think more research needed to be done. Because, in the past, we've funded not-for-profits and we've given them money for vehicles, but we've had contracts with those agencies. In this particular case, we do not have a contract with the Recovery Kitchen. Well,
Don't you have a contract with them for meals?
I certainly can't, but
You
through, for DSS.
There's a contract advance for this.
So you mean for this particular department?
mhm.
Okay, thank you.
And so what I had asked Dan to do was to develop a contract saying that it's providing services for people who have mental disabilities as well as substance abuse issues, because they do serve, unfortunately, the substance abuse program. But I just wanted to have some type of a contract if we were gonna give them that kind of money, so.
And I can speak to that because I know that some of our residents at the Berkshire Travel Lodge have those dependencies or issues and their meals are delivered regularly by the Recovery Kitchen, so.
Okay, this is federal salary share money too, so
So it's not county
it's
tax
not county
dollars.
tax dollars.
So you have a motion in a second.
I got the second?
Yep.
All in favor?
Aye.
So it goes. Carried.
Okay, this is done at Jim Breed's request I needed to do a resolution to tweak the budget for 2024. We ended up using a lot more consulting work than we anticipated. We saved salary dollars, but they're two different. One's a 0.1, one's a 0.4. So to square it, I have to take this to committee. So it's 32,000 extra in professional services, but we got the savings from the salary line.
So you said you reviewed that with Jim.
Jim actually signed off on it. I don't know if you go further down, you'll see the signature on it.
I'll move it then.
Second.
Any further discussion? Okay, so carried.
And the next one's also a budget mod. One of our providers, Unity House, got some COLAs during the year, and we did not anticipate that in the 2025 budget because of the timing issues. So this is simply adding 3869 to state aid and 3869 to their receivable.
Move it.
Second.
Discussion? All in favor?
Aye.
Aye.
So carried.
And Kelly, there'll be one, Jim mentioned.
He's gonna bring
it's
some
gonna
finance.
Yeah.
For 2024. Okay, this is a request to abolish a behavioral health social worker and create and fill a new behavioral health care coordinator. Dan, I got this through point one a week or two ago. This actually will save the county some money. It did take our one vacant position, a vacant social worker position. Now it takes away that vacancy and actually saves the county $11,000.
I'll move it.
Second,
Discussion? So carried.
Okay, this next one is to renew our contract with the 1011 Group. They provide our electronic health record. We've been with them, I guess it's 15 years now. It's hard to believe. This next contract is for a 3-year extension from May 11th, 2025 to May 10th, 2028. It does come with like a 10% increase in cost, which we did budget for in 2025. But this is the next phase. Otherwise, we would not have a electronic health record. Support it.
the resolution says an 8% increase. Is
About
it?
8%.
Okay.
Yeah.
Okay.
Just
Just want to be sure.
Yeah, I actually do have it accounted for in the budget.
I'll move it.
Second?
Second.
No discussion? So all in favor?
Aye.
So carried.
The cost of the new electronic health record should be staggering.
Oh,
The next, is a contract with Fordham University. They have, some student interns, that could work for us, and we want to get a contract in place so we can access it.
One second,
discussion?
free labor.
Yeah. All in favor?
Aye.
So carried.
Okay, the last one, a little tricky. The opioids settlement, regional abatement money came in for 2025, $119,158 is allocated to our department. And of that money, we'd like to allocate 35,000, up to 35,000 to People USA. Dan would like to start a marketing campaign to help promote the hotline, the 24-hour hotline, as a resource to the community. So out of that 119 that was allocated to us, we'd like to use 35,000 of that.
Can you explain what they do?
Well, I brought the expert here.
Okay,
I
that's.
don't know about that.
Melissa is here.
So the hotline he's talking about is the helpline that's run by Columbia County Pathways to Recovery.
Okay.
And the idea is to use that as more of a one-stop resource line. So directing providers and the community to that line for anyone who has questions about any kind of mental health or substance use needs in the county. We've also developed a resource guide that we're giving to the volunteers of the resource line that they can use, and it contains all the resources in Columbia and Reno surrounding counties.
What were they doing prior? How did people reach Columbia County Pathways?
They have a helpline that they use, but
Okay.
it's limited in scope. It's not promoted, really comprehensively throughout the county or surrounding counties. So people who are in treatment or in recovery may know about it, but if you have a mental health issue or a family with a mental health issue, you might not know to call them.
So you're gonna replace that line with this line?
But keep the same number, and they
Okay,
already have
all
a
right.
staff with volunteers, which is why
So
it
it's
was decided to
continuity.
keep that infrastructure
Okay.
and really promote it in a wider way and really include more mental health and substance use resources.
And just quick, how are you gonna promote it?
I'm sorry,
How are you gonna promote it?
well, that's where we hire People USA, who are the
And
experts.
then, so you're gonna outsource that?
Yes,
Okay.
outsource the marketing part of it,
Yeah.
yes.
Okay. I'll move it.
So I have a question. Is that a real person that answers the phone?
Yes, yep, it's staffed by volunteers.
Where are they?
Good question. I think they're at their office, which is located in Chatham at One Taconic Place in Chatham. But I'm not quite sure if they can do it, are allowed to do it outside their office space.
I'll second.
Further discussion? All in favor?
Aye.
And so carried.
We got,
That's it? Okay.
Thanks, sir.
oh, you
Thank you.
unless you wanted to do a quick overtime.
It's such a huge number.
One thing I would like to just point out to everyone here, the guys are in a lot of comp time, with on-call stuff. But they usually don't cash that in. The reason we actually even have expense is because we have two of our guys have reached the limit of comp earned and have to get paid out for it at this point, which is the reason, as you know, Chairman, that we started we negotiated a contract with the union to make sure everybody does on-call, so we don't have the situation where only one or two people do it, and they end up maxing out. So it'll be a small number, like. Thank you.
Thank you.
Thank you.
Melissa?
It's a do something.
Pardon me?
No, it's.
Nope, I was Melissa. I was with Jeff.
Yes.
Welcome back.
Oh, they're ganging up on us.
Okay.
Yeah. Well, I will let you know that there was a grantee due little Miss Cecilia. Has arrived. Congratulations. Yeah. Cece. Oh, Cece is here.
That's sweet.
Awesome.
Okay.
So this one is for the Director of Children with Special Healthcare Needs to bid and award and execute the transportation contracts.
Second.
Discussion? All in favor?
Aye.
So carried.
And the next one is for authorization to renew contracts listed on appendices A, B, C, and D for a period of 3 years. So all of the, center-based agencies are listed. And
I know we renew these contracts annually, but do we use the services of each of these organizations annually, or do we just have them on call?
well, you never know who you're gonna need and who's gonna be available is the problem.
Okay, no, I understand.
Yeah, okay.
Just a point of clarification.
Motion,
Move it.
second,
Second.
all in favor?
Aye.
And so carried.
And the next one is to authorize the health department to contract with Eileen Sanderson OT to provide preschool services to eligible children. Since we have such a hard time finding therapists, this is a blessing.
Move it.
Second.
All in favor?
Aye.
So carried.
And the last one is for authorization to fill the one public health nurse position that is vacant.
That was 3.1 as well, so.
I'll
make
move
that
it.
motion.
I'll second.
Okay, all in
And then-
favor?
Plenty of activity.
Point of discussion also is we are going to have a, RN leaving us in April. So it's harder and harder to fill these positions. And,
All in favor?
Aye.
And so carried. You're on the ball.
Just to be efficient.
There you go. I love
Double
it.
checking.
Yeah, I know.
Victoria did submit the, public health director's report.
Yeah.
And then other topics, I brought our expert here in case you have any questions about the wastewater policy.
Are you bringing a resolution next month to pass the wastewater? Like, are you giving them, because we didn't have a resolution.
No, just point of discussion.
Okay.
I know that Ray Jakowski had reviewed it and it's fine with the policies, so. And I believe that, Mike, who also was involved in
And Rob, someone said.
Robert Simmons. So, I mean, everybody, I think, from that end was good with what
Right.
was done, so.
Okay.
No, I appreciate your work on that. I did get to read it today. Just a couple of questions on the process. I know we talked about this being a priority of the code. Are we trying to adopt this first, or is this just gonna be part of the code when it gets adopted? Do we know that?
Well, I think we wanted to.
What's the steps towards,
We wanted to get it approved as a policy.
as a
first.
policy, just this part of it under
Um,
wastewater?
You know, it's kind of crunch time since Mike is.
Yep, no,
You know,
yeah.
retiring.
That's
pretty
why I
soon,
asked. I
so-
don't know.
Yeah, and then hopefully later on, we can adopt it into the
Into a code. Okay,
code.
so we'll do this first as a policy.
Correct.
And we did, when we met regarding this issue,
Yeah.
now it's probably what, 6 months ago?
Yeah.
We had asked them to work
Yeah,
on this
no, I
first,
remember we focused on that, but I just
Right.
because this was the most urgent.
wasn't sure how we were approaching
Then we
approving it.
pick and choose what else is gonna be in it moving forward.
So this would allow us to deal with whatever's coming in the way of personnel changes.
Correct.
Right, yeah.
Yep.
Trying to be proactive.
What am I doing? with
Love
that?
that one.
Yes,
At this point,
nothing.
Stop it.
right.
Just bringing it
We're gonna
further.
bring it back.
Okay.
So a resolution next month.
But thank you.
Thank you, ladies.
But yeah, I did get to read it and it looks pretty straightforward and simple, best you can.
Yeah, we tried not to make it, too complicated,
Yeah.
and Mike and Ray were a huge help. So
Yeah.
if they're good with it, I think
Yeah.
the chairman's good with it. I'm happy.
We're heading in the right direction.
Yeah,
anyway,
we're
you know?
getting there.
One of those things you adopt and then you'll find out how it works.
Yeah, exactly.
Thanks so much.
Thank
Thanks,
you.
ladies.
See you next month.
Just a second, I'm catching up with myself. Okay. It's gonna take me long. What's that mean?
He does that to me all the time. I don't, you know.
What he doesn't know is I do it
When I see his name pop up.
So here is this very long 4-year plan. Do you want me, Chairman, to add this to your mailbox, or would you like to peruse
Give it to Kelly.
for your reading pleasure? So I don't know if it's because we had the day off yesterday or because I've been elbow deep in that document for 2 weeks, but I am all sorts of out of it, so I'm gonna apologize now. I don't even know what year we're in anymore.
You're fine.
Whew, that is a doozy, man. I don't have a whole lot for you. Just a resolution to contract with the healthcare consortium, which I'm now realizing this says health consortium. Do I need to change that? For our MIFA contract.
I'll move it. Second.
Discussion? All in favor?
Aye.
And so carried. There we go.
And then just some general updates for you. We've got some learn to knit and crochet coming to all of the senior centers with our Warm Up America friends who donated all of those hats and mittens and blankets, which we still have a tree in the hallway. If you know of anybody that needs winter essentials, we've got a tree up right outside of our office for free. We're looking at bringing a genealogy class, and I can't remember the woman's name. That was through our partnership with the town of Valatia. So we're looking at bringing a genealogy class to all of the sites. Our MIPA training, which we just did the contract for. The Energy Fair on February 1st, I think had a huge turnout. We had a bunch of people stop over to our table. I brought my laptop because I thought I'd be able to answer, emails. Nobody's going to pay attention to me. It's like people were there all day long, which I think is really cool. So I think there's a couple. Is there one happening in Canaan? Energy Fair, or is it Chatham? Maybe?
I thought there was one in Chatham.
There is
Like,
another
you
one
mentioned
someplace, yeah.
This was Valatia. Valatia.
Yeah.
Tomorrow night at the Chatham Library.
There you
Then
go.
all's
Thanks,
online,
Danelle.
so
Making sure I'm doing my job.
making sure he's awake.
Right.
That's it.
And I think they mentioned the one, maybe southern part of the county coming up too. So I think that'll be good. Seem to have a lot of really good resources there. Last week, which is another reason why I'm really out of it, we went up to the Capitol to advocate for some important issues around aging services across the state. We had one of my staff members come with me. 2 of our advisory council members went, and I was like a proud mama there. I thought I was going to cry. I was like, this is so exciting to have us all here. We got to meet with Assemblymember Dee Dee Barrett directly, and then we met with the staffers for Assemblyman Scott Bennett and Senator Henchy, which I thought was also really exciting. Some really good conversations and invitations for this conversation to continue. So stay tuned. Hopefully good things will be happening there. I am resuming my town board presentations. We've got Ancrum scheduled for next month, and then Cloverton and Hillsdale probably within the next month or 2. We've got them, we don't have dates yet. Our Valatia site reopened, if you will. No pauses to service there because we aren't open on Fridays. So we moved everything on Friday and reopened at the new site, which is the town hall, Valatia Town Hall location on that following Monday. So we've been open for a month and it seems to be going really well there. Volunteer of the Year nominations will be closing February 28th. So if you know of anybody, this goes to everyone in the room. And I say there's no shame in nominating yourselves. If you know of anyone that is of the older generation that is still volunteering and contributing to society, we'd love to hear about them, interview them, and maybe pick them to win. But like I said, that closes in about 10 days. And then personnel, we've got, our 2 registered dietitians have officially onboarded. Tomorrow is our first menu meeting. So I'm hoping to bring them, I don't want to overwhelm them too much in their first month. So I'm hoping to bring them either next month or probably to the April meeting so that you can meet them. We will have them going around to meet all the participants at the senior centers coming up, and probably introduce them to advisory council as well.
What'd you get?
We have Lynn Hart, who actually used to work for New York State Office for the Aging. She wrote the program standards that we use. So that's pretty exciting. I feel like we've got a cheat code to figure out how to do it the best way.
Was she the first one to come on board? Or is she the one the second one that's coming on board?
She was the one that we found through, because she has a contract with, I believe, the jail. I think it's the jail. So I found her through there, and then because of the requirements of the job, you know, there's not just the nutrition counseling, there's the education piece, going out and doing community education. She wanted to have a little more leeway, so she brought on Juanita Bryant. So they're under the name of Bryant Nutrition. So yeah, we're really excited about them. So I'll have them here to meet you. We've got our one of our cooks is retiring at the end of the month after, I think, 18 years with us, which is, you know, bittersweet. But so I'll be coming next month with some 0.1 stuff for you there. And then we've got our NIPA high cap, that's our health insurance kind of guru. I call her our high cap highness. Highness is medical leave through March. So cross your fingers because that stuff's confusing to me. But I think we're okay. We're set up pretty well there. And then I just wanted to point out a couple exciting things. We've got in talks with community participants trying to maybe set up some type of drop-in respite center. And we officially got our booklet in for a memory group, which I only brought one to look through, but I thought it would be pretty interesting to give you something tangible to look at. This is there's an app, Life Bio, I think it's called, if I remember correctly. There's an app and then a physical booklet that you can do. And this booklet is actually for us to hold an actual group session. So anybody who, you know, might have some memory deficits that wants to kind of get their legacy down into a book and then keep that to share with their family members and loved ones. This is a cool way to do that. So we have that coming up soon. I just had a meeting today with NYSOFA about, they're called MedQR bracelets. I'm going to be able to get 100 of them for our county. And once we get that kind of worked out for free, I'm going to probably partner with Glacier Rescue Squad because we already have a business agreement in place with them. And we work really closely with their MIH, Mobile Integrated Health Services program. So this MedQR bracelet will have either the Columbia County seal on it, because that's our current logo right now, the OFA logo, or the NYSOFA logo on it. And it has just some really cool tech features that are above my understanding at this moment. I just got a new iPhone and still haven't figured out how to connect this watch to that one yet. So they're going to teach me how to do it.
There you go.
But it is essentially, you know, those medical bracelets that people wear. It's kind of that, but a little bit elevated, where if someone were to come into contact with emergency personnel and they tap that or utilize whatever that QR code is, it'll register to the emergency contacts. They'll get a text or a phone call, I think. So we'll have that. I'll bring in more information when we learn about that.
And how will we decide who gets them?
I think probably in conversation with the Glacier Rescue Squad would be the best idea, because they're going to be kind of the professionals there to identify who they're maybe coming in contact with.
We should have some kind of policy about that.
There is a county that has a policies and procedures in place that they piloted there with a little bit, so I can get that. They should talk about sharing that today. I was also thinking, you know, in place of those PERS, the personal emergency response, the life alert style, you know, necklaces, the way that people get them through our office, they're not available to everyone. So that could kind of mitigate, you know, if you're not eligible for the PERS unit, maybe we get you this. Because with that bracelet, you're not able to call 911, but it will interact. If you are already interacting with them, it'll kind of let your emergency contacts know. So this was one of the first meetings we had about it. But when I hear something's free and they want to run it, I'm like, yeah, let's check it out. So we'll see. And then, yeah, I mean, there's a lot in here. So once this gets approved, I'll share with everybody. I mean, there's like 75 pages of stuff.
What's the name of that again?
The bracelet. I believe it's MedQR, and it's through, I want to say it's SCS Resource, MedQR.
And the state is just buying them as a pilot and they're distributing them to OFAs across the state.
Yeah, each county that showed interest is going to get about 100 bracelets.
Okay.
I mean, you can opt out, but I say why not, you
Are
know?
they electronic? Do they require battery?
It sounds like they don't, I don't know how, this is the part that I
Right.
don't understand. They don't require, charging of any kind. And I don't understand. I don't
They have
know.
some of those, they have 10-year lithium battery, stuff like that, like
Right.
a most that there's a 10-year battery.
Right.
Blows
It's
my
probably
mind.
very similar technology.
And if someone who is given the bracelet, you know, were to pass away or decide that they don't want to use it, they can wipe it
Mhm.
and reset it so that it doesn't, you know, we don't have to send anything back. It'll just come back to the office, reset, and we can give it out to somebody else.
So we'd have to have some kind of agreement that it would come back because they remain the property of the county.
So it would have to, if my thought process is correct, and it looks like if they have the QR code, the medical people would be, the responders would be the one that would scan it with some kind of a scanner
Mhm.
that would pop up and give them all the information about that person, like their
Yes.
diagnoses, medications, and
Similar
emergency
to those
response.
metal ones, yeah. And then
That's-
in addition to them getting that information, it also would ping whoever you
Yeah.
set up as your emergency response.
Oh, so you're saying it would have the medical history as well as the medical contact? Okay,
Mhm.
that's a very different thing.
I don't know about it, and it lists on there, it's kind of basic medical history, right? It's, you know, name,
Allergies, name, date of birth,
any,
might, talk
Yeah.
about any kind of,
kind of like one of those.
that's what I'm seeing on here,
Metal
but,
bracelets.
I don't know how this one's going into.
When you
They
get one,
don't-
bring it in
it's
and
like-
show us.
They did say, actually, I'm sure it'll shock you that I was made fun of on the call today because it's so hard to make fun of. They said
Not
demo
what Matt
bracelet.
said, but.
Yeah.
They said demo bracelet and I responded back in the email afterwards and I said, oh, that dummy bracelet sounds really good. And they're like, oh, you're calling it a dummy.
Yeah.
So, that would be me, the dummy. But yes, we will have, a dummy bracelet that I can actually wear while I'm out tabling and show people and it'll, you know, it won't ping any emergency responders or anything like that, but it'll show up so I can show them exactly what it's gonna look like on my phone.
Yeah.
And the necklaces that you said before, because I wasn't familiar with that, the necklaces are already available in the county?
Yep, so we have, an agreement with, I believe it's Trinity Health we
Okay.
partner with, for the PERS, personal emergency response system. Thank you. Good. When I tell you, this thing has fried my brain. So similar to those Life Alert, necklaces, certain people who are eligible can get them through our office. Some insurance companies will cover them, so we'll work with people to find the best way for someone to get one of those.
You're the contact point, have them contact.
Yeah, I mean, we always tell people, just give us a call. We can,
Okay.
if we can't do it for you, we're gonna find a way for you to get one. if
The
you need one.
life alerts are a subscription and they're about they're $700-800 a year, I think, for life alerts. So is this an equivalent cost?
It's a lower cost version,
So it's income based?
yeah.
Okay.
Okay.
And then if it, you know, if someone isn't eligible, say through our office, we can usually help them set up with, you know, another agency that might be able to do it. Some insurances will cover it.
Okay.
There's some alternatives that aren't necessarily the necklace itself, but maybe another setup that would work for them if they have a caregiver, various, different ways around how to get it.
And the necklace has an alert?
Yep.
Okay.
Now, getting
It's a
people to
vitamin push.
wear the necklace is really
Kind
gonna
of,
be
that's the fun
challenging.
part.
Well, my mom never takes hers off.
I'm so happy to hear that.
Never
because
takes it, except in the shower. It's not waterproof.
A lot of people like to leave the necklace on the bedstand.
Then they get
They
up and go
do,
to the bathroom,
yeah.
fall down and, yeah.
I can't get through it.
And do you have a little print piece or trifold on the PERS system?
I can get one, yeah.
That would be,
So I can't.
you could email it to Kelly and she could send it around. Because I wasn't aware that we had that either.
No, me neither. I'm thinking of one other.
Anything else? Any other questions? Oh. That sounds like that, okay.
But that's it, but they also do ones that I saw that have, like their name and their address and contact phone numbers, like right on this little bracelet.
Mhm.
It looks like it's kind of engraved, so I don't know which one, because somebody would have to have,
Yeah, I figured we can try this and see how.
see what
people
it
like
is, I'm
and
curious, yeah.
If they don't.
In this
Who
medical.
has QR code readers?
Any
cell
I
phone,
think,
right?
any cell
See, that's
phone.
what worries me about this. It's got medical information or private information. And any cell phone can read that information. Somebody loses their bracelet.
You
But if
may,
it's
you
a-
may have to have, I mean, you may have to have a special app. I mean, it could be,
I know, but that's the reason I asked the question. I don't know.
Yeah, it would probably
Yeah.
have to be like, I have a medical scanner where I work for pharmacy, but I can't
do it.
use my code.
Yeah.
Yeah, I can't use it on my
Yeah,
phone. It's
certain,
just-
certain software, certain apps.
I
may
just
have-
want to make sure that there is a
Yeah,
privacy.
no, I agree, I
protection,
agree.
I know there's
Especially for older people.
a feature built in, so there's the tap feature
That's the only
that
thing
you
I
can
have
use
left
instead of
that's
the QR code. Like if you put your phone directly on top of the bracelet, and it has to be directly in a specific contact for that to work. And that QR code is pretty small. And to be honest, because I haven't seen the actual bracelet yet, I don't know if the QR code is on the outside of the bracelet or on the
Something you open
inside.
it, sense it, right,
So, yeah.
which would make more sense. Because otherwise it could also be damaged or abraded, so it's not readable.
Mhm. So we'll
Be
find out
interesting to see.
when I get that dummy first.
What is this? This is something you do every
This is
year?
the 4-year plan.
Does this come to all of us eventually?
I think it's,
Okay.
so I don't know if they still do this, but once it's approved by the state, I think it's sent to you. And then you send it to me?
Normally,
Okay. So it is for, what are we? This is 2024 to 2028. This is kind of our plan for everything we're gonna do in the next 4 years. It's got fiscal pages in there to try and, predict out.
So is it 2025 to 2029?
This,
Or is it retroactive?
it's
from last
retro because it
Okay.
came out, I think they're supposed to send it out in October and we didn't get it until April. Or no, we didn't even get it in April. I think we got it in June.
Of last year?
Yes.
Okay.
It's very
the
confusing.
state is notorious for. things
In
like
fact, we have we just submitted this Friday and the annual update, which is kind of the first year, is due, well, it hasn't opened yet, but it's gonna be due in like 10 seconds and
Well, congratulations on getting it done. That's a great accomplishment.
thank you. I don't know.
Hard to
if it's
plan 4 years
accepted
out.
yet.
I know, you know, like 1 month out and stuff. It's.
Imagine for a week.
Is it like a work that you have to
Yeah,
fill out?
kind of like, these are our goals and objectives and the action steps to meet those goals.
And you had a public hearing.
We did.
I went to the public hearing.
And the public hearing at the time, if I recall, this hadn't even been opened yet.
Yeah.
So we were kind of like, well, we're gonna keep doing what we're doing. This is a little more detailed. We've, you know, it's kind of ideas that we've been talking about here, and now they're actually put into a document, which is simultaneously exciting and terrifying because that means it's gotta happen, so.
But do they hold you to it, or is it just like a generalization of where you'd like to go? And then you try
I
to
don't know,
follow it?
this
I
is
mean,
my
it-
first one, so we'll find out if they hold it.
Normally you do updates and then
Each year.
You can make situational.
if there's a goal or an objective that they haven't met or can't meet, they can always amend.
I tried to have realistic goals. Hopefully they're realistic, we'll see. But yeah, once, Kelly, do you want me to hand this to you now or to put it in?
Yeah, I'll take it.
Once it is approved, I'll bring it back for everybody to look through.
So when the towns and the county is going through the update of the hazard mitigation plan, which is also, it's a similar cycle. And the first thing we did was we looked at the goals that we established the last time around, and they said, which of these have you accomplished? And are the others still relevant? And so you can basically cross them out and say yes, no, or maybe. So you're not gonna be in hot water if your goals have changed.
A mini comprehensive plan, yeah.
Was there anything else? Can I make a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
See ya.
All right, we'll call this, February Public Safety Committee meeting to order. First up, we have, Public Defender.
Evening.
Good evening.
I have, 2 resolution requests this evening. First being, I'm requesting permission to advertise and fill a position of an assistant public defender, which became vacant February 13th of last year, or this year, I'm sorry.
Second.
Have a motion and a second, further discussion? All in favor?
Aye. And then the second, requesting authorization for Columbia County to enter into a contract to fill a vacant position of the nighttime arraignment attorneys, to the passing of, one of them.
Move it. Second. Have a motion and a second. Further discussion? All in favor?
That's 100% funding.
Yes, 100%, under the CAFA program. Thank you.
Thanks.
Any other questions? No, thank you. Okay, next up, we have fire.
I don't think George is,
He's not here.
but he does have one
Yep.
resolution.
So we have a resolution reappointing Robert Adrians and Gary Mazzacano to the Columbia County Fire Chiefs Association to the Fire Advisory Board for 3-year terms commencing 1/1/25 and ending 12/31/27.
Second.
I have a motion and a second. Any discussion, questions? Because I can't answer them. All in favor? All right. Next up, we have the sheriff. Yeah, I was gonna say, this is gonna take longer than the rest of the meeting, Sheriff.
As usual.
How are you, sir?
Doing well.
Good.
Anybody falling out?
Yeah.
Not yet.
My driveway isn't.
We'll get there on Monday before you.
Yeah, right.
So, I'd like to put forth a resolution for authorization to fill 4 deputy sheriff's positions. Salary 63,000.
I'll move it. Second.
Motion and a second. Any questions, discussion?
These are all resignations?
These are all openings and, there's a plethora of different reasons. We have 11 openings currently. We were authorized to fill 4. So if I can get those 4, that'd be
You have
extremely helpful.
4 in class, right? Or have they
4, we have
already?
4 in field training currently.
All in favor? Opposed? Carried.
Second, authorization to fill 2 corrections officer position with a salary of 51,500.
Move it. Second. Motion and a second. Questions? All in favor? Opposed? Carried.
Authorization to fill 1 communications officer position and a salary of 52,740.
Move it.
The motion and a second. Questions? All in favor? Opposed? Carried.
Authorization to fill 1 keyboard specialist position with a salary of 46,103.
Move it. You're kidding. Second. Motion and a second.
That's just the one quote I got.
Any questions, discussion? All in favor? Opposed? Carried.
Authorization to fill 1 sergeant deputy sheriff's position at a salary of 90,400 due to retirement.
Move it. Second. A motion and a second. Questions? All in favor? Opposed? Carried.
Lastly, is authorization to enter into a renewal agreement with Prime Care Medical for medical needs in the facility.
Move it. Second. Have a motion and a second. Questions? All in favor? Opposed? Carried.
Then we have the out-of-county incarcerated individual report. I think they went back to calling them inmates, but we'll stick with incarcerated individuals for safety's sake. Dutchess County, 5,580, or 5,580. Green County, 10,425. January's total $16,005. Year-to-date, $16,005. Previous year was $11,200. I don't have what we refer to as another report for the out-of-county stuff, but I can get that to you.
Anybody have any questions for the sheriff?
Sheriff. Yeah, where you find all the sheriff deputies are going?
Well, we've historically had a shortage, and it's not too much that they're leaving. In the last year, we've been pretty successful holding on to them, but we had some retirements. We did have, I believe it was 3 last year that went to the state police, but right now we have 11 openings, and
They're paying much more, unfortunately.
we've been up and down for a while. Corrections, we've been pretty successful with. We have 4 openings right now, so I think these 2 filled, and we have people that want the positions. I have 11 on the list right now. They're all pretty good candidates. Right? hustling through them right now, so hopefully we can get back to full staffing before the end of the year. It's just get the money to
Thanks, sir.
y'all. Stay warm.
Next up, emergency management.
Afternoon.
Good afternoon.
Our report, if you have any questions. Also, I wanted to make you aware, about a month ago, New York State Dishes came to us with a flood mitigation equipment program that they're reaching out to every county about. We were, Greene and Columbia were the first counties that they approached. I contacted the chairman. He felt that it was something that would be beneficial. They're heavy duty pumps, high diameter hose, chainsaws, a sandbag filling machine, 10,000 sandbags. Just a guess, it's probably at least $25,000 worth of brand new equipment. It's gonna be staged here. It won't be us that would necessarily use it. So, we sat down with Ray Jakowski and talked to him about it, and Tony DeMarco, and they felt that they absolutely could use the equipment. They can use it in between because they continually are doing flood mitigation, whether it's, huge culverts that they're trying to clear out, that's flooding roadways.
Like this weekend.
Whatever. So that's something they already do. If it's needed in an emergency, they'll respond with it. So it's a good thing.
Where will the equipment be kept?
They can keep it wherever they want.
Okay.
That basically, we sign an MOU with them. Chairman does, and they can store it wherever they want. New York State can come down and check on it if they want, but they can use it whenever they need to use it. And, at the end, when it's not usable anymore, we just let them know, and then we do what we have to do with it. But, and this was something.
So they own it and we can use it whenever we want, or do we own it and they can use it whenever?
No, it's there. They own it. It's staged with us. They may ask us to go to adjoining counties if
Okay, transport.
Yeah.
but otherwise we use it as we need it. And, if within the county, there's a request, for flood stuff assistance, which they already do.
Right.
Then they have this equipment, they could use it. No, it was really a no-brainer for us.
Sure.
And they felt it was a good program, and, we were glad to do it, and everybody out that we talked to, they were glad to do it too.
Excellent.
Well, is this just for emergencies, or can they use it?
No,
Highway department, could they use it if they're doing a culvert and they got a pump?
Yeah, that's flood mitigation. Anything that has to do with flood mitigation, it doesn't have to be an emergency.
Okay.
And that's why it made sense to go right to, DPW, and we already do it.
Oh, yeah.
So now, obviously, the sandbag machine, you're not gonna use unless there's it's an emergency or whatever, but we'll have it. It's a huge thing on wheels. Couple of generators, it's all brand new. They're gonna ship it to our highway garage. Highway will keep track of it, where it is. They'll put it in their outpost wherever they feel it's best, where they think it would be used the most. And, we use it, so.
Excellent.
Damage, wear, and tear, theft, who's responsible for it?
It's their equipment that they put here. It'll fall under our umbrella, I assume, as far as insurance goes. We have to maintain it. So we would maintain it, but other than that, and we can back out if we want. At some point, we feel for whatever reason, we don't want to participate in it anymore, we can give it all back. So there's really very little strings attached to it, other than they can come down whenever they want and say, hey, we want to look at it. They'll know where it is and they'll be able to look at it. So.
Sounds like a good deal.
Yeah, and just the MOU looks basic.
Just spreading out the resources throughout the state. I mean, like I said, if there's a need in Rensselaer County, they can say, hey, we need this up there.
And it doesn't stop us from requesting more of that.
I was gonna say it works the other way.
Yeah. If it's all being used on what we're dealing with and we need more, we can request more, from other counties, or they'll send it from.
If DPW is doing replacing increasing the size of a culvert or something, they divert the water to do that. They say, I need 2 of these pumps to pump the stream.
Do you know if they've approached any other nearby counties?
They, Green County the same
bet you
day,
said
yeah,
that.
because actually we put it, because it was really out of the blue. And they called us 2 days and said, hey, can we meet with you in 2 days? And they arranged to sort of Green County, because we had another meeting scheduled. They met with Green County and Columbia County at our building the same day, so.
Understood.
Green County said they were gonna do the same thing, reach out to their, county highway.
I was just wondering if there were any others nearby that you know about. 'cause you
Not,
did mention-
they're, my understanding is gonna go to, they're going to every county.
Oh,
And
fabulous.
now, the bigger counties may get more stuff, or different stuff, or whatever, but,
But if you need it, you can call on them too.
yeah.
That's good.
So just tell our highway guys, get in touch with the highway garage. They'll know where the stuff is if they need it.
Yeah, just gonna hold, however they would do it now, if they need help from the county on a flooded, a plugged, whatever, you know, it's stuff that they already use, that's why.
Oh, I
it's
know.
a no-brainer.
I know we had to rent quite a few of the pumps.
Yeah,
lifted pumps and stuff.
reach out to Tony DeMarco or, Chris DeGaff.
All right, I'll tell Louis.
I think Chris is the one that they put in charge of the program for them, so, yeah. So it seems like it's gonna be great. We received our Red Cross Emergency Shelter trailer early last week. They were saying they were gonna stage that at our county. We have that. It's got 100 cots, it's got blankets, it's got other stuff. We've always had an MOU with them, but we added this trailer in. We would actually be able to take it, say there was an issue and they wanted to start a shelter in Canaan, which we almost did last year, but we could take that up there and meet the Red Cross there, so it would take less time. So we're glad to have it staged in the county. I'm waiting on the MOU for that, which should come anytime. The chairman approved it. He said he thought it was a good thing to have. There was one station in our county previously. It was at a firehouse, but they wanted it to be at the, where our facility is. So they took that trailer, refurbished it, put more stuff in it, and just stuff, and then brought it to where fire coordinator's cool with it. So that's something that's, and also we just started planning for an exercise, evacuation exercise at the firefighter's home. That's just some initial stages, so. So what's coming up. Any questions?
Any questions? Thank you, sir.
Yep.
911,
Evening, everyone.
good evening.
I have two resolutions for you tonight. First one, request of.
That's it. I knew I wasn't even gonna get the signature page.
Second.
I have a motion and a second. Any questions? All in favor? Opposed? Carried.
Should take that as a compliment.
Yeah. Move it.
Second.
Oh, geez, you didn't get to say this one. I gotta sign it? We have a motion and a second. Any questions? All in favor?
Aye.
Opposed?
Rob, you don't even have to show up.
I don't even have to show up for this.
No,
Yep.
they already gave me one.
All right.
Casey Grant.
You get to talk now.
All right, so, call volume for the month of January, we received, incoming call volume was 3,395 calls. We dispatched 1,445 EMS agencies, 305 fire, 863 police polls, and 446 public service calls. The only other thing I have is, I've submitted the annual report for 2024 for your review.
Anybody have any
Rob,
questions?
I got
Go ahead.
When you do the fire call, okay, like that, do you guys keep track of, like, say it's a structure fire? It's not a fire, it's just something else.
Yep, every
So you
single
keep
one.
track. Have you noticed that the fires have been going down over the years?
No, they stay consistent.
Do they say,
Because sometimes it spikes up a little bit, but if you run a long average, they're about the same.
same, okay, still hold?
Yeah, okay. I think the need for fire service, though, is the role's expanding. They're looking to, they're calling for everything for the fire service to rescue a dog out of the ice or, a horse or this and that. That's stuff we never used to dispatch.
Right, and a lot of accidents.
They kind of treat.
Accidents are the biggest one, I think, that's coming up, right? They get called up for all that.
Yeah.
So.
Any questions?
Are you the deputy
Thank you.
chair? Are you the deputy chair?
I am the deputy chair of this committee. Yes, sir.
Excellent job.
It took longer than last year. I typically get the February meeting because it's vacation time for Rob. So any questions from the public? Any questions from supervisors?
Motion adjourned.
Motion to adjourn. Have a second. All in favor?
Later.
Have a good night, everyone.
Thank you.